Hello everyone, today we will be discussing healthcare professions. There's actually a lot of professions besides doctors, nurses, and dentists involved in the healthcare field, and we will be discussing those today. Not all of them though, there's a lot. There are many different career paths associated with healthcare. Doctors and nurses cover just a small portion of the jobs available in healthcare today. Besides doctors and nurses, some of the other jobs include allied health professionals and non-clinical healthcare jobs. In the following video, I will go over some of the different types of nurses, the multiple different types of nurses, the jobs of allied health professionals, and also non-clinical healthcare jobs. Here are 3 non-clinical healthcare jobs, according to Aaron, no date. Medical transcriptionist. This job often requires an associate's degree, and a person needs knowledge of medical terminology. The position's main responsibility is to access patient history and enter new clinical information into the patient's medical file. Medical secretary. The training for this position can be found at vocational high schools, training institutes, and community colleges. This job oversees the flow of information within the medical office. Knowledge of medical terminology, again, is needed, and software skills are vital to this position. Healthcare administrator. This job often requires a master's degree in healthcare administration. They oversee the flow and organization within the office. Other skills include understanding law and ethics in healthcare, finance management, and policy and procedure implementation. 6 allied healthcare professions. Allied health is a term used to describe a broad range of health professionals, and basically it's anybody that's not a doctor, dentist, or a nurse. The following is a quick list and description of 6 professions in the allied healthcare field. Pharmacy technician. This is someone who assists a licensed pharmacist in dispersing prescription medications to customers. Medical assistant. This position can involve clinical and non-clinical work. They could be tasked with direct patient care or management of patient data and health information, according to the American Institute of Medical Sciences and Education, 2017. Phlebotomist. This is everybody's favorite, drawn blood. This is the person who draws a patient's blood and prepares it for testing in a lab. Dispensing optician. This person takes a prescription from an ophthalmologist or optometrist and uses the prescription and dispenses and fits glasses for that patient. A dental assistant. This is the person who helps a dentist by preparing for the dentist. They can set up prior to the patient arrival, sterilize equipment, again, set up. Or they can also aid the dentist in direct patient care. Health information technician. This is a person that manages and organizes patients' data and other health information. According to the American Institute of Medical Sciences and Education, 2017, using different classification systems to categorize information for insurance reimbursement purposes, database registries, and maintaining patient medical histories. Sounds like fun. To some people, it actually is. Here's 3 different types of nurses, according to the U.S. Bureau of Labor Statistics, 2017. Licensed practical nurses, LPNs. Educational requirements for LPNs require that they complete a state-approved education program, which takes about 1 year, and become licensed. Responsibilities in an LPN include, but are not limited to, distribution of prescribed medicine to a patient, giving shots, taking vital signs, wound care and cleaning, and recording medical history, according to licensedpracticalnurse.net, no date. Registered nurse, RN. This is who the LPN works under. And educational requirements for RNs are a bachelor's degree in nursing, an associate's degree in nursing, or a diploma from an approved nursing program, according to the U.S. Bureau of Labor Statistics, 2017. Responsibilities of an RN include and are not limited to providing and coordinating patient care, order, interpret, and evaluate tests to identify a patient's condition, according to Charter College, no date. Nurse practitioner, NP. Educational requirements for a nurse practitioner is a master's degree in one of the areas of advanced practice registered nurses, APRN. They must be licensed within their state and pass a national certification exam. Responsibilities of an NP include, but are not limited to, working directly with patients to manage and diagnose common chronic illnesses, perform physical exams, order and interpret tests, and write prescriptions, according to MGH Institute of Health Professionals, no date. Conclusion. There are a myriad of jobs involved in our current healthcare setting. Some are entry level and don't require much education, this being like a medical secretary. Others require an associate's or bachelor's degree. Examples of these would be medical transcriptionist and a registered nurse, respectively. Higher up the ladder are positions like a healthcare administrator or nurse practitioner, which both require a master's degree. For those looking for a job in healthcare, they will always enjoy job security. Healthcare isn't something that is going away. It is a field that is always growing and needed and will always require people with different education levels and skill sets. Thank you very much.